A trial of early antiretrovirals and Isoniazid preventive therapy in Africa. Definition: Antiretroviral therapy, an asymptomatic human immunodeficiency virus, HIV-infected adults in lower resource countries was increased from 200 cells per cubic millimeter in 2006 to 500 cells per cubic millimeter in 2013. This change was supported by the results of two randomized controlled trials. They have consistently been shown to be a major cause of death among HIV-infected patients in settings where access to diagnosis and treatment is low.
One in 4 people who start antiretroviral therapy in Africa start late. They start when their CD4s are already below 100 cells.
We're still getting teenagers quite ill, and people in the early 20s quite ill, with the more severe forms of TB, pneumonia, and blood infections.
This is the group where HIV-related death mostly occur.
Applications in medicine. Antiretroviral therapy has been shown to be effective in reducing the risk of HIV transmission. This observation led to the hypothesis that recommending all HIV-infected persons to start antiretroviral therapy irrespective of their CD4 count might help curb the epidemic. This public health argument, however, is acceptable only if earlier antiretroviral therapy leads to a favorable benefit-risk ratio at the individual level.
Treatments for HIV have come a long way since the virus was first discovered in 1983. While scientists are still working on a cure for HIV, there are several drug therapies that can help HIV patients live long and full lives. The most common and effective therapies used today are retroviral drugs, which work by specifically targeting the virus that's infected a person's cells. Current retroviral drugs cannot completely eliminate the HIV virus, but they can keep virus levels, called viral loads, to a manageable level and prevent HIV from progressing to AIDS. There are 5 classes of retroviral drugs, and each is designed to attack the living virus at different points in.
Pros and cons. Pros: effective in reducing the risk of HIV transmission, reduce mortality rates. Cons: might select resistant bacilli, toxic effects, mainly digestive and neurologic effects.
The side effects of efavirenz can include a variety of things related to the brain. Sometimes people get very dizzy, sometimes they get headaches. Another common side effect with efavirenz is to have very bad dreams at nighttime. So these kinds of side effects can sometimes make people very nervous that something is totally wrong with their medicine or their body. Patients should always talk with their doctors about their side effects first, especially if they consider them to be severe. But many of these side effects do get better with time. Sometimes it is a question of dose, making sure that the patient is on the proper dose to avoid the worst kinds of side effects. Rash is a very common side effect with 2 particular antiretrovirals that are commonly used.
In Ecuador, the Ministry of Public Health of Ecuador guarantees universal and free access to comprehensive care for patients with HIV. The different health houses of the Ministry of Public Health, there is a sufficient stock of medicines for 9,043 patients with HIV who have antiretroviral treatment and are treated in the Integrate HIV/AIDS care units located in 22 specialized clinics throughout the country.
A retrovirus. It enters the cells, inserts into host genomes, makes new virus, and can persist for the life of an individual. HIV reproduction involves several steps, and each step presents an opportunity for antiretroviral drugs to stop the virus. The outer shell of the HIV particle is called the envelope. It is studded with sugar protein spikes that allow the virus to attach itself to specific molecules called CD4 receptors on some human cells. The viral core contains two important features. The HIV genome is carried on 2 strands of RNA. These strands contain only 9 genes, in contrast to the 500 genes in the typical bacterium and
Conclusion: in this African country, immediate antiretroviral therapy and 6 months of Isoniazid preventive therapy independently lead to lower rates of severe illness than did deferred antiretroviral therapy and no Isoniazid preventive therapy, both overall and among patients with CD4 counts of at least 500 cells per cubic millimeter. Thank you.